Hello everyone, my name is Lauren Axthelm and I am currently the IT manager for Serenity Cancer Complex in Memphis, Tennessee. Our facility specializes in cancer treatment and management for people ages 18 to 50. Our goal is to make their fight with cancer a comfortable, positive one, but we also want to be able to help them in any other way we can, such as going to therapy, exercising, finding a new job, going back to school. However we can help them, we want to be able to help because fighting cancer is a tough time. In today's world, many things regarding healthcare are now digital and connected to the internet. This poses an entirely new threat to healthcare systems than ever before: technology security. So what exactly does that mean for Serenity Cancer Complex? It means as the IT manager, I have to make sure that all of our security measures are running at their best. Patient data and medical devices must be protected, and only certain employees need access to certain information. For example, the cleaning staff don't need access to patient data and patient records. Only doctors, pharmacists, nurses, medical staff need that kind of information. Making sure access to our data center is secure is also another important security measure. Only our IT employees can get into our data centers and closets, but all of our medical and administrative employees can get into our actual network and like EHR, medical systems, things like that. Employees have access to these data systems by swiping their employee ID badge and in some cases also using a PIN number for two-step authentication. But recently, we faced a very serious security issue. We had a brand new order entry system for the pharmacy. Doctors enjoyed it, pharmacists said it was easy to use, it made their lives a lot easier, but unfortunately, a hacker, by the use of a Trojan horse that got into an employee's work email account that was accessed on their home computer when it shouldn't have been, got into the system and changed medication dosages for some of the patients. This unfortunately led to the deaths of 2 of our patients due to overdoses and drug interactions. 20 patients were affected by the dosage error, and over 500 of our past and current patients had personal identifying information stolen, such as social security numbers, credit cards, home addresses, anything someone could use to steal someone's identity. Obviously, as the IT manager, I was devastated. I should have been able to stop something like this. But my team and I didn't dawdle, and we quickly got back to work to fix the problem. First, we began checking for security patches more often. We used to do this once a week, and now we started to do this every 48 hours. We also created a 2-step authentication system to approve drug dosages since the hacker had overridden the pharmacist's approval of the changes. We never wanted that to happen again, and so now what we have done is, one, we're only having it where pharmacists' computers can be used to approve drug changes. It used to be that pharmacists could approve the drug change from any computer, not just their own, but now it has to be the computer in the pharmacy, and they have to use their employee ID badge. They have to swipe into the system, and then they have a 4-digit PIN unique to them, and they have to use that as the second step of their authentication to ensure that they are who they say they are and they are actually approved to make this change. We also have new warnings within our electronic health record system to alert users, such as a nurse or a doctor, to more clear and effective pop-up warnings, such as drug interactions. So many times doctors and nurses may ignore these warnings because they've seen it before, or they think they fixed the problem, or maybe it's not relevant at the moment, and they just close out of the warning and totally ignore it. Well, the next time could be the time that they did need to ignore it, that it was very serious and it could harm the patient. So now we've made these warnings more clear and effective and less able, I guess you would say, less able to ignore it. This whole situation was terrifying, and I hope I don't ever have to deal with an issue this life-threatening again. But obviously, no healthcare technology system is perfect. Every system is going to have an issue. But here are some questions for you as a student to think about regarding our security issue. First, why is 2-step authentication becoming more important to implement in both the medical technology world and everyday use? 2, why do systems have fail-safe warnings, and what could be done to ensure these warnings are not ignored? 3, as the IT manager, Obviously, I should have been doing much more than I was to protect our network since it had gotten broken into. And people have now died and potentially have had their identity stolen because of this unfortunate incident. But what are some new challenges Serenity Cancer Complex and its IT department face due to this issue and this incident of information being stolen and people dying? And lastly, how would you improve our IT security, both physically and digitally, to ensure that unauthorized users do not have the chance to access our system? Once again, thank you for letting me come speak to your class today. I'm very thankful and grateful for this opportunity. Have a good day.